Let's talk about antidepressants. The way we prescribe and understand antidepressant is confusing, outdated, and is wreaking havoc in women's lives. And I think I may be part of the problem. Like many doctors, I'm not sure if I truly understand antidepressants. Writing a prescription is easy. I at least to try to come up with a way to assess my patient's mental health, making sure that particular antidepressant is the right choice and that she has a follow-up, usually in 2 weeks, again 2 weeks after that, and perhaps every few weeks. But how common is that? Probably not, because often this particular medication is prescribed without proper assessment and proper follow-up. So here are some shocking facts I'm going to be sharing with you. These are the same thing I'm sharing with my patients to help them better understand what antidepressants is all about. Fact number one, the theory behind depression, or serotonin theory, has not been validated with scientific data. Let's talk about serotonin. What is serotonin? Serotonin is a chemical. It is a neurotransmitter, meaning it is a messenger which makes us who we are. Most serotonin, or 90% of it, is produced in our gastrointestinal tract, responsible for intestinal movements, and the remainder in the central nervous system. It is responsible for everything from our thinking, mood, memory, to many physiological processes. And the current thinking is depression must be caused by chemical imbalance. This theory was first suggested in the 1960s, and after the introduction of the very first SSRI, or serotonin selective reuptake inhibitor, Prozac, this has been the main theory behind depression. So, is that true? I think it's oversimplification. I think it's like treating fever with Tylenol without knowing the underlying cause behind the fever. And we now know that no scientific research has linked serotonin with depression. There's absolutely no data suggests it is serotonin's lowered concentration or activity that causes depression. Fact number two, antidepressants don't really work. I know you may be surprised to hear that, but the truth is, it doesn't really work. 5 out of 6 people, when asked, reported minimal benefit from taking antidepressants. A large study involving over 17 million Americans over the course of 10 years, when looked at overall quality of life with and without antidepressant, marginal difference. Now, antidepressants do work for some people because their clinical symptoms may have improved. But if the standard is comparing to placebo, then we know there is no scientific data to validate the efficacy of antidepressants. In fact, more than half the people taking antidepressants, the benefit they report probably is related to the placebo effect, not the chemical structure itself. Then, if you think about the cost and all the side effects from antidepressants, we cannot be satisfied with current trend where antidepressants are being prescribed so widely. Fact number 3, most antidepressants were approved based on short-term usage. Actually, between 8 to 12 weeks. That's the duration of most antidepressants clinical trial. Yet, something under 20 million Americans have been taking antidepressants for years, well over 5 years. There's absolutely no data which supports the long-term usage of antidepressants. In fact, concern is that, first of all, it doesn't work, and it may be dangerous, and given all the side effects, should you be taking for years rather than for weeks as it was meant to be? There's no objective data like people having better employment rate or lower disability rate. There's no individual overall quality improvement data that says antidepressants are working over a long period. Lastly, I want to talk about the FDA involvement with antidepressants. But this is a big one. In 1970s, the FDA came up with a guideline for the approval of antidepressants. This was over a decade before the very first SSRI or Prozac. Guess what? That outline has not been updated since then. In fact, there's no new type of antidepressant in the market in past 20 years. You know why? Because the outline has not been updated. These drug companies have no incentive to come up with anything new. And new antidepressants, which were introduced in the past 2 decades, are all variation of previously approved antidepressants. Nothing new. But this last thing is more shocking. Depression scale. When antidepressant is being assessed, a person would take the scale before trying a new medication for X number of weeks, and at the end of the trial, the person would take the same test to see if there has been improvement. But the FDA has not standardized this depression scale. What does that mean? It means Pfizer is using one version and Bristol is using another. And so how do you compare the outcome? I mean, it's like kids taking SAT tests, but they all have different sets of questions. How do you compare the score? So we're talking about the FDA, which has not improved the overall approved guideline, as well as not standardizing depression scale. How do we, me particularly as a provider, how do I compare one antidepressant over the other? And I tell you how I do it. I usually try one, and then we see how the first 2 weeks go to make sure that my patient doesn't have any side effect. And then 3rd and 4th week to see if it's doing anything. But it's usually the 2nd month. Often patient may say either it's doing something or not. It is very confusing. And the FDA has not done anything to make our lives easier. Can you imagine? Antidepressants are the most prescribed medications in this country. Again, more Americans are on this medication than anything. So the bottom line, what do we do with antidepressants? If you happen to be one of those people where a particular medication is doing something, then you stay on it. But if you ever thought of coming off, or if you're not doing well with it because of all the side effects, what are the side effects? It could be anything from feeling nervous, agitation, losing your balance, to diarrhea, constipation, sexual dysfunction, to weight gain. Man, talk about side effects. These are common side effects of antidepressants. If you happen to be suffering from these, you may want to come off. Or if you've been on it for too long, you feel like it's not doing anything, you may want to come off. Is there a way to come off antidepressants? I think there is. But before I go into that, let me tell you what a country like Great Britain is doing. In Great Britain, there's a nationalized healthcare, NHS. The government is telling its primary care providers to not prescribe antidepressants initially as the first choice of therapy for depression. They're suggesting things like social prescription, which means group therapy, art therapy, dance, anything but taking the medication. Why? In England, 1 out of 4 women are on antidepressant. And again, we are becoming aware of what antidepressant is doing, or more importantly, not doing. So, if you are told that you may benefit from this, should you start? Well, I think you should think about alternatives. What are the alternatives? CBD. CBD, I think, is a very viable alternative. And if you want to get off or wean off antidepressant, I think it can be done with the help of CBD. Here are a few things I suggest. One, it should be slow process. If you're on, say, Lexapro or 5 milligram, that may take you months to come off that without suffering from withdrawal syndrome. Again, same thing you're suffering from from taking antidepressant, some people can suffer from coming off. Agitation to diarrhea, common GI side effects to not feeling well, just flu-like symptom. Slow process. It should also be done with a provider, ideally, and consider CBD. I am helping women do this very thing, weaning off antidepressants. And I tell my patients it's a slow process. It can be done, and we use CBD to wean off antidepressants.